I am going to be demonstrating how to do a lung assessment, a musculoskeletal assessment, and an abdominal assessment on my patient here. First off, for the lung assessment, I'm going to auscultate 8 landmarks on the patient's back. So we start off up top, towards the top of the back, in or more, and I'm going to ask the patient to take a deep breath each time. So here, 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 and here. Down the patient's back, asking them to take a deep breath each time. For the musculoskeletal assessment, I would put my fingers out like this, ask the patient to squeeze my fingers, and then I would put my hands out like this and have them put their hands inside of my hands and push out while I push in, and then have them put their hands outside and put my hands on the inside and have them push out. And then I would put my hands facing down and have them put their hands facing up while they push up and I push down, and then put my hands facing up while the patient's hands are facing down, and I would push up while they push down. I would ask the patient to bend their knees and then straighten them back out. And then I would do the same thing as I did with the hands with the patient's feet. Have them push in while I push out, have them push out while I push in. For the abdominal assessment, I'm looking for a couple things. I would start with 3 very important questions. First question is, when was the patient's last bowel movement? What is their usual bowel movement pattern? If they have 1 bowel movement a day or 2, around what time of the day they have bowel movements, if they have bowel movements after they eat. And last question is, when did the patient last eat? I would put my patient in a supine position, laying down. And then the important thing for the abdominal assessment is to look at the abdomen, listen to the abdomen, and feel the abdomen. So looking at the abdomen, I would be looking for the shape. If it was flat, round, concave, or distended, my patient's abdomen looks round. It does not look concave or distended. I would then be looking for the symmetry of the abdomen. Make sure that the abdomen is symmetrical and not asymmetrical. I would then listen to the abdomen for 1 minute in each quadrant, starting in the right upper quadrant of the patient's abdomen, and then go clockwise to the left upper quadrant, the left lower quadrant, and the right lower quadrant. Like I said, 1 minute for each quadrant, making sure I am hearing active bowel sounds, which is about 5 to 25 sounds per minute. If I hear an absence of bowel sounds, I would have to listen for 5 minutes in each quadrant. And then the last step is to feel the abdomen. So I would just kind of palpate the abdomen, making sure, kind of feeling if it's soft or firm, if the patient has any tenderness or pain when I press around the stomach. And then lastly, I would percuss by taking my 2 fingers and just tapping on the abdomen. During percussion, you could either hear a dull sound, which would be over an organ, such as the bladder if it was full, or you would hear a tympanic sound, which might indicate that the patient has some gas in their abdomen. So that's all my assessments. Thank you.